It is part of my workflow. I come in the morning, I pull up my charts, and I go right into HealthInfoNet. I've been using it in tandem with my medical record. I am not computer savvy, I'm a nurse. So, that's not one of my strengths. So if I find it user-friendly, then that's saying a lot.
I find it useful when I'm looking at ED admissions or discharges on patients that may be coming in the next day or that I'm seeing in the afternoon, and I try to get the reports, lab reports, any hospital admission, discharge, med rec, anything I can get my hands on before they come in.
Have you been admitted to the hospital or been to the emergency room in the last 6 months? And they'll say, no, or gee, I think I did once, but I don't remember when. I can log on to HealthInfoNet and it's right there.
This helps me tie all the different providers that a patient has, whether it's different specialties or different ERs or walk-in cares, or just brings the whole picture together for the patient and makes the PCP aware of everything that's been done for the patient.
They may have gone to Mayo or they may have gone to Down East and filled a prescription there somewhere, and somewhere along the line I can see it now. Or I couldn't get my handle on that before. I'd have to spend, half an hour, 45 minutes calling pharmacies to find out, okay, can you tell me what they got? What is the dose? But I can do this here now, which is great. It saves me so much time. I'd rather have my attention on them rather than trying to find reports.
I have a patient who lives in Augusta, but she sees one of our PCPs, and she goes to the ER quite frequently. She has COPD, and she's had a lot of different issues with pneumonia. And so I was able to get accurate information on how many times she's been there, what's been going on when she's there, so that I can update the provider so that they know what's been tried, what's not been tried.
I have a lady that I call about once a week that had actually been to the St. Joseph's ER, I don't know, probably 3 times over the course of a weekend, and they'd done a bunch of testing, and her PCP was going to do a bunch of testing because she was concerned about this lady's health. And I said, oh, wait a minute, I think she had a bunch of that already. And we were able to get into HealthInfoNet and not duplicate testing, so it actually saved a fair amount of money.
One example I can think of, I had a patient that didn't show up for an office visit. He always shows up for his office appointments. So the provider had sent me a note, can you check on him? Tried to call him, couldn't reach him, but I was able to go into HealthInfoNet and find out where he had been. He had been admitted to another hospital and sent to Boston.
The continuity of care is a huge part for us, especially as care managers. We want to piece all of this together for the patient to make it one piece of paper for them to give them at the end of the visit that is concise, and they can read it and it makes sense to them, and they can walk out the door feeling like, wow, now I know what meds I'm supposed to be taking, or now I know what my allergies are, or I now know how to take my inhaler, where some of that stuff gets lost without all the pieces of the puzzle.
Recently I had a patient that has multiple providers because of his chronic diseases, and he's seen at different sites. He was coming to see his primary care physician here, and we were going to draw some labs for him that were due, but because I had gone into HealthInfoNet prior to meeting with him, I saw that the labs had been drawn recently. And he had had so many labs done that day, he couldn't remember which test was done. He had heard us mention about HealthInfoNet, but really it wasn't tangible to him. Why that is a benefit, and so that gentleman that day was able to save himself a needle stick, which is uncomfortable because he has a chronic illness. He does get his labs drawn quite frequently, have lost to tests and procedures, so he was grateful to not have to add another one to that.